Thank you. Hello, everyone. My name is Ashley Pena. I use she and her pronouns, and I am the Pregnant and Parenting Family Substance Use Disorder Policy Administrator within the Division of Behavioral Health and Recovery, and I am lead on the Grace Harbor Project. Next slide, please. So on this slide, we're going to find the Grace Harbor Project proviso language. It instructs the development and operation of a 16-bed substance use disorder inpatient treatment facility in Grace Harbor County, specializing in treating pregnant and parenting individuals and their children. The facility must allow for parents and children to reside together while the parent completes treatment. The authority, which is me, must contract for these services through behavioral health entities in a manner that allows for leveraging of federal Medicaid funds to pay for a portion of the cost. The authority must consult with the Department of Children, Youth, and Families in the implementation of this funding. Next slide, please. So the operating budget section for this proviso is the total funding for the project is $1,703,000 for the fiscal year 2025. And of that, $568 is for documented startup costs. If a provider, however, can begin developing services before June 30th, 2024, I will notify the Office of Financial Management and the appropriate committees of the legislator, and submit a request for funding in the fiscal year 2024 for a supplemental operating budget. Otherwise, the implementation of this funds will begin in the fiscal year 2025. Next slide, please. So in partnership, and as instructed by the proviso, in partnership with DCYF and other cross-agency stakeholders, a family preservation model has been defined as a family preservation model is a multifaceted approach to substance use disorder treatment across the continuum of care. The model integrated into a residential treatment facility serves pregnant and parenting individuals and their children. The I in PPI includes fathers and couples. The model is equitable, serving underrepresented vulnerable populations, incorporating an interdisciplinary approach to reduce barriers for families. The model is culturally centered, designed to serve diverse family system. The model aims to provide trauma-informed care through a person-centered approach and/or a family-centered approach. A goal of the family preservation model is to keep families involved in child welfare systems safely together or to work towards reunification. The heart of the model is whole family-centered healing. Next slide, please. A substance use disorder residential treatment facility serving pregnant and parenting individuals and their children. Implementing a family preservation model must provide on or off-site services, including but not limited to the components outlined in this slide. I will leave this up for a few moments so folks can read through that. Next slide, please. The current status right now for the Grace Harbor project is there's a procurement process for the Grace Harbor project, and it is going to be a two-part competitive procurement process. The goal is to have a provider contracted and services begun on or before June 30th, 2024. Thanks so much.
Thanks, Ashley. We really look forward to what this program looks like in launching in 2024.